Hi, friends. I'm Callan. I'm a dual board certified nurse practitioner in behavioral health as well as primary care. I'm a human in midlife battling perimenopause. Excuse me. I'm post gastric sleeve. I experienced weight regain, and now I'm documenting my GLP-1 journey in real time. So here you're going to get a clinician perspective as well as a patient perspective. And if you're new here, welcome. If you're not new, welcome back. And let's get into week 3 on Mounjaro. So, first of all, let's just get into some stats because this is week 3. The end. By the time you watch this, it's the end of my week 3. But we're discussing on how week 3 went for me. This is still 2.5 milligrams of Mounjaro is my dose. So far, I'm still holding at 7 pounds lost. And I'm still holding there at that loss. I've gone up and down a little bit, kind of fluctuated, but it seems consistently, pretty much on average, it's still at the 7 pounds, which technically, with all the research and all the science, that is a very good place to be 3 weeks in. So, still a good place to be 3 weeks in. Still good weight loss and pretty consistent weight loss for just being 3 weeks in. Now, my head knows that, my scientific mind knows that, um, my clinician mind knows that. My human mind is like really struggling. The emotional side of me is like, okay, why am I stuck here? Why am I stuck here? But then I'm like, it's only been 21 days. Like, really? Come on. But to be honest, that's kind of how I feel though. Like, it's the middle of next week will be a full month, and I still can't really be upset at 7 pounds. So, if you're going through the beginnings of your journey and you're at a little place like that where you haven't maybe said anything out loud, but you feel stuck, like, why is it not moving anymore? Understand that that's just water shifts. The beginning is just inflammation going down. I can tell inflammation in my face has gone down a lot, and my belly has gone down a lot. So, clothes are fitting a little bit differently. I still am doing weight training. Um, 3 to 4 times a week, really 4 to 5 times a week. I would be on like consistently 4 days a week that I'm doing weight training at night. I do my exercise at night. I find that it's quieter then. No one is needing anything from me. I'm done working, and I am less likely to make an excuse for why I can't get my workout in. For me at night, I am less likely to make an excuse when I have everything in my office. I can just do it before I shut the office down for the night and go to bed. So there is no excuse why I can't get it done, or it's less excuse. Now I will say there has been some fatigue. Um, and at first, I know that can be a side effect with the medication, but I don't think that has been the case for me. I think it's really been hypothyroidism. And when I first started this journey and had my labs done initially, before I even started the therapy or the medication, that's one of the things that came back, metabolically looking like it needed some help. And I had subclinical hypothyroidism probably maybe 10 years ago, and kind of corrected it, lost a little bit of weight, ate a little bit better, that kind of thing, and it shifted back and corrected itself. However, now at almost 44, it was back with a vengeance. I think my TSH level, which is thyroid stimulating hormone, I think that was like 5.8 or something like that, which is very elevated. And so that means that the thyroid stimulating hormone kept trying to stimulate my thyroid to work better. And so when that number goes high, then that means that you're in hypothyroidism. It is not functioning well. And so I think that was the cause of the fatigue. And I'm hoping now, this week, I went to the endocrinologist, got everything straightened out there, got evaluated, talked with her, and we decided on levothyroxine. I will be taking 50 micrograms of that for as you know, until it stabilizes. Either we'll go up on the dose or we'll just stay at that dose. And so I'm really happy about that. I personally take my levothyroxine at night. Um, Now, I am a medical provider, both as a psychiatrist or in that way of a nurse practitioner, mental health nurse practitioner, and primary care. But I am not your provider. So everything I talk about here is um, educational information only. This is not medical advice or it's not meant to diagnose you because I am not your provider. I have my own providers that I consult with. So everyone needs to talk with your own healthcare provider about managing your health. But in saying that, traditionally what we tell patients is take your levothyroxine on an empty stomach, take it in the morning, wait 30 minutes before you eat anything. Now, for me, that doesn't work because um, I'm too busy in the morning, whether it's getting the kids off to school. In between that, I'm drinking some water or flavored water or something like that, so or my protein coffee. So it just doesn't work for me. I can't wait 30 minutes, right? But what I can do is at night after I've eaten my last snack or meal, and I've drank, the last of my flavored water or whatever for the day right before bed, I wait 3 to 4 hours after I've eaten the last thing, and I take that with just straight water, and that's the last thing I do before I lay down. So that works for me. I think it's going to work really well for me. I take all of my medications at night anyway, so it just works better for me. And I recommend, even what I tell my own clients, my own patients, that you have to figure out what works for you as far as taking your medications, as long as that medication isn't clinically designed to be taken at a certain time of day. If it is not, if it's just a matter of it needs to be taken on an empty stomach, there are ways that you can um, mitigate it to fit your schedule. And that is the most important thing that I talk to my patients about, is that we have to figure out how your care plan and how your treatment plan can fit into your life. Because if it doesn't fit into your life, you're less likely to stick with it. So if taking medications works better for you at night, talk to your provider about it and say, hey, is this something that I could switch and do because I feel like I could be more consistent with it if I do it this way. Just have a talk with them about that, okay? Um, like I said, the weight loss has stayed the same. I still have a goal of 125 milligrams. I always say milligrams. 125 grams of protein, um, which, listen, if you can't reach 125, do not beat yourself up about that. I barely reach 125, but that is kind of my goal. Some days I get up to 130 depending on what I eat, and some days I only make 90 or 96 or whatever, and that's okay too. I just want to have a goal to reach, and I want to be on the higher end of that goal or as close to it as possible at the end of the day. I focus on protein, 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 and fiber. I try to limit my carbs to less than 120 per day, which is what we consider like a moderate carb diet. I am not trying to do super low carb because, again, I am a VSG patient. And so um, that will be very difficult for me to do that and still have energy because I don't eat a lot in one sitting. And I have to eat like 4 to 5 small meals a day. And so my carbs are probably going to be a little higher, but not anything above 120 for the day for me, carb wise. And I've been able to stick to that, so I think that's really good. I think it's a healthy space for me. Um, I would say that week 3 has been pretty cool in the fact that I feel like I'm settling into this new life, and a lot of times in the past, if you've tried to lose weight, for a long time, you'll try this diet, you'll try this program, you'll try this diet, this exercise, and then it'll stop. And this hasn't stopped. Um, the food noise is still gone, which is still mind blowing, but it is still gone. And there have been some tests this week, and I think more emotionally is what I've seen a change in this week. Um, even on a day when I had one day where I was kind of irritable, kind of moody, stressed out a little bit, working a lot, tired, and realized that I didn't have food to turn to as like solace. So I'm up late at night working. For the most part, I've been going to bed at 11:30. But this was a night that I went to bed late. And after doing that, like I was frustrated because I wasn't finishing as quickly as I wanted to because it just like another, as soon as I was done, like if you're in healthcare, like as soon as you think you're done, like there's another thing, especially if you're a provider. It's like another question pops up, another request pops up. I gotta put in another refill for someone. Like it's constant, right? And so that's what was happening that day, and I was getting frustrated. And usually, what would happen is I would DoorDash something to myself that I wanted. I would go and get a Snickers. I would go and eat something sweet. I would literally bake cookies if I wanted to have something or make a small cake for myself. Like I would make whatever I want to have, a bowl of chips, whatever, to feel that. And I didn't have that to fall back on because I didn't have those cravings anymore. And initially, it was kind of scary, and there was a little bit of fear because I didn't have that. But then after a few minutes, I realized, well, I didn't want that, and that's okay. And then I found a healthier way to release that, which was, getting up, jumping on the trampoline, and doing a couple of weights, and then I was able to get that angst out. And so that was huge. Another thing was it was Valentine's Day, and the kids celebrated it in school, right? Happy Valentine's Day to you out there as well. But they brought home candy, right? All the candy, all the snacks, all the gifts, all the cards, everything. They brought home everything, and I didn't touch a piece. And they had some of my favorite candies in there. Like I love like Laffy Taffy type candies, and oh, they had so many of those in there. And I was not triggered to eat one. I did not crave it. I didn't want it. I didn't even reach for it that night when I was having a bad night. So that game changer for me. That's a game changer for me. So I am really, really happy with um, with Mounjaro and how I'm feeling with it. I feel like I'm getting comfortable in it. I'm feeling comfortable in my skin with it. If that makes sense. Where like I'm doing my shot. I'm good. I'm weighing myself consistently. I weigh myself every day. Please, if that triggers you or upsets you to do that for yourself, don't do it. I personally do it because I'm a data nerd and I graph it and track it because I want to see when I go up, when I go down, what did I eat a lot of sodium that day? Did I not drink enough water? Like I'm going at this in a scientific way, and so for me, it is not triggering in that way. I want to see it and what's going on, whether it goes up or down. I want to see it, even if sometimes that might give me a twinge. Um, and I realize a lot of that is because when I started gaining weight back after surgery, I would hit like 240, 250 mark, and I would just stall there when I was trying to lose again, when I was trying to reverse that weight gain. And I just couldn't get past that mark. And so for me, being stuck at 253 was kind of triggering in that way. So having to address that mentally for myself and emotionally for myself, I didn't want to stop weighing myself because I want this data. And so I didn't let that stop me um, doing that. But, everything's pretty much been good. Um, like I said, I have the fatigue. I think that was about the thyroid. And like I said, we're going to talk about thyroid later in the video. But it's been a good week, and I'm looking forward to week 4 and to see how everything goes with that change in dose. So right now I'm at 2.5. I will do 2.5 for 4 weeks. That was my last 2.5, and now I'm going to go up to 5 milligrams. Per the research, as we amp up around 5 to 7.5 is when we really start to see a change in that weight loss. And so I'm looking forward to that. Also, I'm now taking thyroid medication with the levothyroxine, and hopefully that will amp up my metabolism and get it going. And so we'll see more weight loss. Okay, quick clinical corner. What I want to talk about this week is thyroid health. Now, I just said earlier, like I said, that I think the fatigue that I had been experiencing was from my thyroid. When I had my labs done before I started the Mounjaro therapy, I was hypothyroid. I had hypothyroidism. Now, I have had this in the past and tried to correct it with like diet and losing a little bit of weight years ago. I never got on medication for it because I was able to kind of correct things. Take some supplements, eat some Brazil nuts, that kind of thing. Brazil nuts, just so you know, is high in selenium, which can help you with your thyroid health. That's just a nerdy point, okay? But it was subclinical thyroidism, hypothyroidism, which means it was on the lower end of normal, but I wasn't truly hypothyroid at that point. And so that's why I was able to correct it with diet. Let me be clear about that. This time, it was very pronounced. This was clinical hypothyroidism that I was in. I believe it was like 5.8. I believe my level was, and anything above like 4.4 or something, I believe is hypothyroidism. Now, remember, I am a medical provider, both psychiatric and primary care. But I am not your medical provider. So everything I'm sharing with you in this video that has anything to do with medicine or the body or how it works or medication, this is for educational purposes only. If you are wanting to go on a GLP-1 journey, if you have issues with your thyroid, if you're having problems with perimenopause or your health in general, blood pressure, your heart, anything like that, please talk to your healthcare provider about your health to make the best decisions for you. Okay? So that's just my disclaimer here. Now, for me, like I said, the thyroid was really, TSH was really elevated, and I also had a lot of the fatigue. So I knew that something was going on there, and definitely it was. So I went to the endocrinologist this week and was able to get everything evaluated and started on levothyroxine, which is a common medication to treat hypothyroidism. So I am taking 50 micrograms of levothyroxine once a day. Now, with this medication, I take it at night. Traditionally, what we normally as providers say, take it in the morning, wait 30 minutes, and then start eating. So you take it on an empty stomach with just water, and then you wait 30 minutes and then start to eat your food or that kind of thing. For me, that does not work. So I take mine at bedtime, which means I take it 3 hours after I've eaten my last snack, my last meal, anything like that. I wait 3 hours, and right before bed, I take that tablet with just water right before I go to sleep. So now I'm going to be NPO, nothing by mouth, basically fasting through the night so it can work. So those are two different ways that you can take that medication. You still have to wait, again, 3 to 4 hours after you've eaten your last meal to take the tablet. But if you're a person who works night shift or that kind of thing, that may work for you taking it that way instead of trying to take it in the morning, which may not work for your schedule. Talk to your healthcare provider about that, but that's just a tip that as long as you're keeping it where it's on an empty stomach, that's a good thing. Okay? So let's talk about your thyroid. Your thyroid is basically your metabolism's thermostat. The thyroid keeps your body level. It keeps it balanced. It regulates energy. It regulates temperature, heart rate, and also how efficiently that you burn fuel. So that you use the fuel that you're giving your body, your metabolism. Now, if you have an underactive thyroid, meaning your TSH is elevated, your labs are elevated, that thyroid stimulating hormone, which is TSH, goes high because it's trying to get your thyroid to work, right? It is trying to get everything to work because it is so low functioning. It is not functioning the way it should. So that's why that lab value will elevate. Okay? If your thyroid is underactive, you will feel fatigued, tired. You will feel you will have weight gain. You may be trying to lose weight, even if you're not on a medication, and can't quite lose it. You can't quite lose weight. You have brain fog, dry skin, itchy skin, and the slower metabolism. Now, all of these can be symptoms of also perimenopause, right? So you may think that you're going through perimenopause, and it may be your thyroid. You may think it's your thyroid, and it may be perimenopause, and that's why a lot of these symptoms cross each other, and it's a very gray area when we start to talk about hormone and metabolism health. And so make sure that you're talking to your provider so you have the right laboratory values, the right tests, so you get the right diagnostic picture so you know how to treat it effectively. Okay? Now, GLP medications, one of the warnings that you may hear about is thyroid cancer with these medications. But in what happened is in the research studies, we have found that rodents taking certain GLP medications were linked to what we call thyroid C cell tumors. Okay, however, it has not been found in humans. We have not had the clear signal or research to show that in humans, but it has been shown in rodents. So one of the things that you look for and that your provider will ask about with your history is if your family, anyone in your family has had medullary thyroid cancer or another MEN2 cancer. These are the cancers that you want to be very mindful of, or it may not be good for you to take GLP-1. Again, the reason why you should talk to your healthcare provider about this if you're interested in starting a journey with GLP-1. Now, with as far as GLP-1s themselves, they do not directly work on your thyroid, but they work on your appetite, right? And insulin signaling, so increasing insulin sensitivity. Now, if you have thyroid dysfunction, meaning like me, if you have a low functioning thyroid, it may be harder to lose weight. Now, as we know, I have the VSG on the other hand, the sleeve gastrectomy that's working, that's probably helping me with restriction, helping me with my weight loss, which is why I've seen some good results so far, even on the starting dose. I believe that in a few weeks after taking the levothyroxine, I'm hoping to see that improve even more. I am really hoping that I see a better weight loss picture throughout the weeks because now my metabolism is also increased. So me working out, eating all the protein, eating my macros like I should, and having now my thyroid, functioning better, hopefully I'll see even more of a body change and a body shift with everything. That's my hope, right? That's what the science says. But our bodies do what they want to do because, it's still a 43-year-old body going through perimenopause. So it's going to do what it wants to do. But I'm hoping that the science helps me in that way. So if you've been struggling with fatigue, if you're on a GLP-1 and you've been struggling with stalled progress or what you feel like is a plateau for a few weeks, check your thyroid panel. Make sure that they're checking your labs. Go to your provider and talk to them about checking your labs so you can make sure that it's not your thyroid and something doesn't need to be uh, adjusted so that you can have a balanced metabolism. Okay? They're going to check your TSH, which is your thyroid stimulating hormone, your T4, your T3. All three of those need to be checked because they all um, play a part in how our thyroid is functioning. Okay? All right, so that's the clinical corner. So thanks, guys, for coming with me on this journey with Mounjaro. I look forward to the next week and what I can share with you all. If you have any questions about medications themselves, any questions about my journey in particular, my history with VSG, any questions, any things you want me to talk about in the videos that I can explain better for you health-wise, put it down in the comments. I want to be as helpful to this community as I can be with the knowledge that I have. One of my passions is education, especially when it comes to our bodies and our health, because I think when we know better, we can do better. And when we understand how our body works, it empowers us to take control and take care of ourselves even better. So thank you for coming along with this journey again. I will see you next week. Thanks for watching. I'll see you next time.